Hello, my name is Rachel Susler. I'm a fourth-year medical student at Indiana University School of Medicine. In this video, we will be talking about gallbladder point-of-care ultrasound with a focus on cholecystitis. A quick overview for this video. We will first go over some quick background information, then we'll jump into literature review of POCUS and cholecystitis. Then we'll review the technique on how to visualize the gallbladder, and then we will cover a few pearls and pitfalls with POCUS in regards to cholecystitis. So first, the definition of cholecystitis. Acute cholecystitis is acute inflammation of the gallbladder. This is most commonly caused from stones, although you can have acalculous cholecystitis, which is more common in critically ill patients. This video, we're going to focus on calculous cholecystitis. So diagnosis of that requires demonstration of wall thickening or edema when visualizing the gallbladder. You can also use sonographic Murphy sign to diagnose it, which we will go over later, or a positive HIDA scan. It's estimated that about 20 million people in the United States have gallbladder disease, and the most common complication of gallbladder stones is cholecystitis. In fact, about 1 in 10 people with stones will need treatment within 5 years. All that to say that this is a very common pathology. So right upper quadrant ultrasound itself is one of the first line modes of diagnosis for cholecystitis. And then after a brief literature review, I found that a formal right upper quadrant ultrasound has a reported sensitivity and specificity of 81 to 88% and 80 to 83% respectively. And then one systematic review found that a physician done right upper quadrant ultrasound, so not a formal one, but a bedside one done by a non-radiologist physician, had a sensitivity and specificity of 89.8% and 88%. So in other words, a physician done bedside ultrasound is pretty equivalent to a formal ultrasound, and both are pretty useful for diagnosing cholecystitis. And then when looking at the individual aspects of a right upper quadrant ultrasound, the combination of Murphy's sign and cholelithiasis itself had a positive predictive value of 92.9%. That was only kind of moderately increased when also looking for things like wall thickening or pericholecystic fluid. Those have low sensitivity but high specificity, but just the combination of Murphy's sign and cholelithiasis itself is very predictive of cholecystitis. So moving into the actual technique of doing a right upper quadrant ultrasound and diagnosing cholecystitis, the ideal probe for this would be a curvilinear probe. A phased array probe can be used, but curvilinear is more ideal. And then in order to do a full ultrasound of the gallbladder, you would need to demonstrate the full gallbladder in sagittal and transverse views. Different methods for performing a right upper quadrant ultrasound and visualizing the gallbladder. The first one is the more traditional, which is kind of the subcostal sweep. So this would be following arrow number 1 on the picture on the right. In this one, you place the probe inferior to the xiphoid process, and then you would sweep the probe following the costal margin until you can see the gallbladder. There's another one called X-7, and this is kind of represented by arrow number 2. In this case, you would place the probe at the inferior aspect of the xiphoid process again, and then move laterally across the ribs approximately 7 centimeters. So you'd be looking in between the rib spaces. In the picture, the number 2 is a little more angled. It would actually be more straight across, but you can use this method to look for the gallbladder as well. And then finally, there's the lateral or transhepatic view, in which case arrow number 3. So in this view, you would actually use the liver as an acoustic window to visualize the gallbladder from the side. And then a few more tips and tricks. If these 3 aren't working, you can try all 3 of them again by having the patient take a deep breath, or you can have the patient lay on their side in the lateral decubitus position. So here are a few videos of me doing the right upper quadrant ultrasound to demonstrate the techniques we just talked about. In this first video, I am doing the traditional approach, or the subcostal sweep. As you can see, the gallbladder is not very easy to visualize here. It got a little better after I had the patient take a deep breath like I talked about, but still not a perfect view. In this video clip, I am using the X-7 technique. In this case, we're getting a little bit better views of the gallbladder. Still not perfect, but definitely better than the traditional. Here is the transhepatic or lateral technique. Again, even better, still not perfect, but definitely seeing the gallbladder better this way. And finally, I had the patient turn onto their side for the left lateral decubitus view, and this was definitely the best. You can see the liver and you can see the gallbladder completely. And of course, in order to make it a complete right upper quadrant ultrasound, I looked in both the sagittal and transverse views, making sure to sweep through the entire gallbladder and both axes. So for a complete exam, you would also look for Murphy's sign. So the ultrasonographic Murphy's sign is visualizing the gallbladder with the ultrasound and then testing for maximum tenderness over the gallbladder that has been located that way. This is different from the physical exam Murphy's sign, in which you'd have like premature arrest of inspiration on palpation. This uses the ultrasound in order to make sure that we are over the gallbladder itself, and then tests a few different spots to make sure that the maximum tenderness is actually over the gallbladder. You will also look for wall thickness with ultrasound in order to diagnose cholecystitis, and this wall thickness should be measured anteriorly, not posteriorly. Finally, it is good to visualize the portal triad to look for choledocholithiasis and to check for common bile duct dilation. Here are a few examples of cholecystitis. Both of them show a stone that is stuck in the neck of the gallbladder. That bright white line is the stone, or what we can see of the stone, and then behind it there is shadowing, which is because the ultrasound waves can't penetrate through the hard calcification of the stone itself. In these examples, you can see both wall thickening and pericholecystic fluid. On the left, the thickened gallbladder wall is pointed out. It's actually being pointed out posteriorly here, but you can also see it anteriorly. And as we mentioned before, when you're actually measuring the thickness of the gallbladder wall, you would want to take your measurements on the anterior portion of the wall. You can also see it pointing out the pericholecystic fluid, which is pretty prominent in the example on the right. Here we have something called the wall echo shadow sign. This is when the gallbladder is so full of stones that you can't even really visualize the full gallbladder. All you see is the bright white line of the stones and then a lot of shadowing. So this is a pretty extreme example of a lot of stones in a gallbladder. So finally, I just wanted to go over a few pearls and pitfalls when it comes to the right upper quadrant ultrasound and cholecystitis. The first is that on the differential of seeing things in the gallbladder includes polyps, and these can be kind of hard to differentiate from stones if you don't know what you're looking for. So on the left, you can see a polyp in the neck of the gallbladder. The way to tell them apart is with stones, you can sometimes see them moving within the patient, especially if you have the patient move for you. But polyps will never change position. They will be stationary. Also, polyps have no shadowing behind them, which is different from a stone, which has a lot of shadowing because of the calcification. And then on the differential of cholecystitis is always choledocholithiasis, and you can check this by seeing if there is any dilation of the common bile duct. An example of this is actually shown on the right. It is also important to remember to visualize the neck of the gallbladder. This is where stones that are symptomatic will be most likely to be found. As you remember from our previous examples, both of those stones were in the neck of the gallbladder. And then finally, something called the exclamation point view, which you can see on the right. You see the gallbladder and then you see the portal vein, which kind of makes an exclamation point. And that's important to visualize in order to differentiate the gallbladder itself from the IVC or the duodenum, both of which are in the similar areas and can be mistaken for each other. All right, and that's all I have for you today on right upper quadrant ultrasound and cholecystitis. Here are my references, and thank you again for watching. I hope you learned a lot.